Ludwig did not have to die. Ludwig did not have to die.
We're here because Ludwig did not have to die. You know, people expect us to just forget about it and act like it never happened. But I know that there are many other Ludwigs out there. Some of them have died because they haven't been given the opportunity to keep safe and allowed to telecommute. I'm fortunate right now. I have underlying conditions. I'm working COVID right now, talking to COVID patients every day. And I will tell you that there are some issues with how the COVID patients are being dealt with. One of the jobs that I have is to give people resources that they need. People who need housing because they can't isolate safely in a household with other people, or they don't want to expose their other family members. People on jobs who have been taken off work, used up all their COVID time, and now they have no income. So there are all these people out there, and the demand is strong. And I will tell you, from a month ago, we were getting like 100 calls a day. Now it's like 600 and 700 a day. That's how many people out there are getting COVID. And a lot of them, fortunately, are vaccinated, so they're not dying, but they still need help. And so this past week, one of the appalling things that happened is we were told there were no more supplies to send to people. And what that led to is, in talking to people, you had somebody who couldn't get a hotel room, riding back and forth on BART because he was homeless and couldn't get a room. Even though he knew he had COVID, he could not be out on the streets because he wasn't feeling well. Finally, they did get him a room, but how many people did that individual expose riding back and forth on BART? No one will ever know. We have people that are saying, well, if you can't give me cleaning products, then I'll just have to put on a mask and go to the store. How many people are out there doing that because they couldn't get anything? Everyone does not have people that they can just call on the phone that have the money to go out and buy them these cleaning products. And that's something very important. And they're living in households with other people where they need to clean up behind themselves because they're sharing a bathroom. They're sharing a kitchen. So I hope that this gets addressed. Ludwig did not have to die. Ludwig was failed, miserably failed by his manager, whose name is Robert Pineda. He was miserably failed by the director in his department. What is her name? Anna Robert. All these people could have saved Ludwig, but yet they chose not to. Now, I think a lot of decisions around COVID are not being made for the right reasons. They're not being made to protect the public. They're not being made to protect us as workers. Because if you talk to the healthcare workers, they will tell you a lot of them do not feel safe going to work. But because they have to feed their families, they go. And because we're disaster workers, we go. And it's not that DSW workers don't want to take care of the people in San Francisco. We see our role as advocating for the people in San Francisco when nobody else is, because we see the things from the inside that are happening to people that they keep from the public. And they don't know what's happening really. And so the rules are changing about isolation, the 5 days. You get a test in 5 days, but you can't get a test. So what are people going to do? Our fear is after 5 days, if you can't get a test and they're telling you can go out, people are just going to go out. And they're going to be positive people out there walking around because they were given instructions that they had to stay isolated for 5 days. And then if they didn't have any symptoms, they can go out. Well, many people who have COVID don't have symptoms, but they're still carrying the virus. So I don't know what can be done. You know, I brought it to the attention of people who I think might address it. But I think there needs to be a lot more observation and a lot more scrutiny on these programs. All this money that came in, half the time you can't find out where it is. They have all these contracts. If you ask the dollar amount to some of the contracts, like, for example, Healthright 360, nobody will tell you even what the amount is. We don't know how much money the city is paying UCSF. We don't know how much money they're paying all these different people. And so there's no way to really scrutinize it and make sure it's being spent properly, the money, if they won't even tell you any of the details about where the money is going. And these are millions and millions and millions of dollars that are going out, but yet in public health, everybody is short-staffed. Nobody has enough people to do the work that they need. And yet, they don't fill the permanent positions that are even vacant. They're vacant positions, ready for people to fill them and be hired, permanent employees, yet they're refusing to do it. What they're doing is they're bringing all these people in as contractors. So these people do not get the benefits that city employees should be doing. They're doing the exact same work as city employees, but yet they're not getting the same benefits. And we've seen more and more and more of these contractors. And a lot of times, we work side by side with these people. You don't even realize that they're a contractor. I know we have a lot of custodians at the hospital now that there's an issue. Some of them have been there 2 or 3 years in these temporary positions. They had a hiring and they didn't get hired. And so the same discrimination that we saw before in hiring is still going on, even in times of COVID. So what we do about that, and that's addressed to Carol Ison. She's the head of HR. We've sat down, I have sat down personally and had discussions with her about fixing some of this stuff. But we see nothing has changed. And in many ways, with all this TEX stuff, it's gotten worse. So I hope that everybody listens to this. It's not personally attacking anybody, but this is something that has to be dealt with. This is about people's lives. People know me. I've been in public health for more than 42 years. I consider myself an advocate for the people that I take care of. And so this is just another mechanism for me to advocate for all these people out here who need resources but can't get them.
Ludwig did not have to die. I was actually Ludwig's supervisor, and I went through this entire process with him trying to secure a safe working environment. But after allowing Ludwig to telecommute, it was rescinded. And no matter how much we fought, no matter how much we went to HR, no matter how many times we requested our union's help, it fell on deaf ears. And it's really sad because as an essential worker, I worked down in the Tenderloin the entire first 18 months of the pandemic, side by side with my workers, not calling in sick. And all we were trying to do, it was really sad when we lost Ludwig, because after being in the pandemic for 18 months and now losing a worker, it just felt so, there's just not even a word for it. And after Ludwig passed away, our department, they gave him a Heroes Award, and we worked through the pandemic and we didn't get the Heroes Award. We didn't even really get much recognition, but yet when he passed away, he got a Heroes Award for dying. Ludwig was, he had a daughter and a son, and then his daughter had a son, and that son, Ludwig was a de facto father for that son and his grandson, and I can't tell you the loss that that family has felt. And the thing is that we're still, it's 2 years now, and since the pandemic, And when this latest surge, they just sent out, Grant Colfax just sent out another memo saying, by almost any means necessary, if you can let your workers telecommute, let them telecommute. Well, I was on the telecommuting committee trying to get this through for Ludwig. And we fought, and then they just put it on hold, and it's not off hold. And I'm here to tell you there's no fairness in public health. How these decisions for essential workers, how you're deemed an essential worker, how it's decided if you could telecommute or not. It's all left up to a manager who may not even have the skill set to assess medical necessity. And Ludwig had a medical necessity. And he told us time and time again, I'm so afraid of dying. He told all of us that in the workplace, all of us, from the medical director on down. So, you know, I mean, it's almost as if we're just replaceable. And the other thing I want to say is about the labor movement. One of the things in the labor movement that was fought for is better health and safety, better working conditions, better paying jobs, benefited jobs. All of this right now, it's being eroded through this pandemic. There's a mechanism that they're using to outsource all the public work through contractors. And what's even worse is our union, a lot of these contractors are in our own union, our own bargaining collection, our union. And so when you ask to file, so case in point, yesterday I had a worker, a permanent worker, and there's a Tom Modell Urgent Care. I work at Tom Modell Urban Housing and Health at 230 Golden Gate, but at Tom Modell Urgent Care 50 Ivy, that was our sister clinic. And one of my workers signed up for overtime back in November. And yesterday was told that it was going to be canceled because he was going to be replaced with a TEX worker. Now, I went to my union representative, and he said, well, I can't file a grievance. I said, can you file a grievance? Because this is about seniority. He said, I can't file a grievance because they're our union member. So they're TEX and we're PCS, permanent civil service, and they're temporary exempt civil service, meaning they are part of the retirement system, they don't get the same health benefits, they don't get the same things that we do. But at the foundation of a union is seniority. And once you erode seniority, then what is the purpose of the union? Now, this worker that had seniority was told, doesn't matter. With the contract, we can't do anything. So my next stop is, I told my boss and the union, I'm taking this to Civil Service Commission. Because when these contracts were signed for these TEX workers, there was a scope of work. And it's not permanent work that are under permanent requisitions. That was not the scope of work. It was to respond to the pandemic, to work in places like the testing sites, the vaccine clinics, the extra work that we don't normally do. But somehow, they took this as a blank check to just bring TEX workers all over the place. And you know what? This is suppressing wages. Because when that PCS worker didn't get to work, he makes per hour more money than the TEX. So the reason they want the TEX is because they're suppressing they're suppressing wages, and our own union is going along with it, and that's the sad part. So where is the seniority? Where is the fight for permanent workers? Now, on top of the labor movement, you know, we had the Civil Rights Act, and we brought this in because it was about economics in marginalized communities like African American, where they didn't have good jobs, where there were no benefits, healthcare benefits, so people didn't have access to healthcare. And so this was all done, but what I see is it's being undone now. And this is the new, really, Jim Crow. this COVID, because it's deciding that people of color like Ludwig or myself, we're not worthy of being in a safe work environment. We're not worthy as essential workers, even though we can do our jobs at home, we're not allowed to. We're not allowed to. So where's the fairness? And I brought this to my union, and they haven't, as far as I myself have seen, I haven't seen any bargaining. I haven't had any communication. In fact, when Ludwig died, they didn't even come to the clinic to like reach out to us. The leadership of SEIU1021, they never reached out. And we lost a brother and a damn good worker. It really breaks my heart, and somebody, a valued member of the community. We lost him. And you know what? They act like it was nothing once he was lost. So the last thing I want to say today is about this privatization. This has got to stop. People got to know what's going on. People got to realize that all this temporary exempt hiring is a process that they have come up with to eliminate, I feel, permanent civil service workers, because they don't want to pay the retirement benefits when we retire. They don't want to pay the health benefits. And when you get rid of those type of benefits, the people at the bottom, like if they have a 401k, they may be single mothers trying to make it here in San Francisco, put food on the table, put a roof over the child's head, and we know that everything is going up. So what happens? They end up homeless or in worse marginalized living conditions. And they can't even contribute to their retirement, their 401k. The 401k is matched by dollar. But if I'm a low-wage worker who is a pseudo city worker, because you're not a real one, and I have to put a 401k, I can only put $10 a month and they match that, where am I going to be when I retire? So this outsourcing has to stop. We need good jobs that are benefited. People deserve this. We need to try to close the wealth gap in this city, because it's huge and it's not fair. And so that's why I'm standing here today to talk about these issues. And I hope that my union, SEIU1021, hears me about getting better working conditions for their essential workers. And I hope they reach out to Ludwig Leota's family, because yes, Ludwig did not have to die. And yes, he was a SEIU1021 union member brother. I hope that SEIU1021 hears this message today and allows the members to have open negotiations for bargaining and to see what is going on. Previously, historically, members could take their own time if they were on a bargaining team, go down there, hear what was going on in negotiations. Everything is closed now. I applied to be an alternate on the bargaining team because we don't have an alternate in our chapter. This past week, apparently they met for bargaining. Half of the bargaining team was out due to COVID. Yet they won't let any alternates come into the bargaining team. The other thing I wanted to bring up is our SEIU1021. We just had a so-called election for the e-board, and there was no election because I guess nobody ran, or the candidates that did apply were not accepted. But one thing, we got an email from SEIU saying that this is our new e-board, and there were a lot of vacancies on the e-board, and it says on the email that at a later date they'll be appointed. But according to our bylaws and stuff, the person who does the appointing is the president of the union, which is Joseph Bryant. Now, our motto is, this is a member-driven union. So when there's vacancies on the e-board, it seems to me that they would hold special elections if this was a democratic process in place. But what we're dealing with is a fascist system here, because it's I can't say the word, authoritarian. And so everything, the decisions are made at the top. How does he know he gets to pick somebody, which sounds to me like cronyism? Why isn't it the people's choice? You know, the members' choice, the people who hit the ground every day and do the work, pay the membership fees, get involved. We should have a voice, and SEIU1021 is silencing that through bargaining, because they don't really want us to bargain. That's what I feel. And so I wanted to add that. And the reason that bargaining is so important this one time especially is because we're in the middle of the pandemic. And for me, like somebody, a supervisor who lost a worker, Ludwig, I have first-hand experience, and I want to be there when they write the proposals and to give examples, but I am not being given access. So I think that this is wrong. And SEIU, you need to do better, SEIU1021. You've got to stop being a corporate union, organizing everybody, and union busting within your own rank and files. It's got to stop. Thank you.
I started to get really concerned when I learned more about the COVID-19 that the primary thing it attacks were the lungs. Maybe about 2 years ago, what happened was I was stabbed where my lungs were punctured and my heart was punctured. So the blade went right through my lungs to my heart. They had to open my chest up, the sternum, and break it open, get to the heart. And in the process, part of my lungs were damaged because it was an emergency operation. So I take special medication for that so that I can breathe normally. The word higher risk group, I understood what that meant. People were fighting for their lives because they couldn't breathe. News about respirator shortages, you know, all this news about the people are dying, their lungs can't get oxygen to the system. I remember that feeling. And here I was facing the reality that this here is a real virus. Here's a real thing that can literally kill you. At that point, emails that were being sent out also offered the opportunity for people who had underlying conditions to apply for telecommuting. I notified my supervisor. I told her, I shared with her that I do fall under the higher risk group. I contacted my provider, my doctor. He responded and had a letter ready for me, submitted it with my application for telecommuting. And I'm submitting all this information, email. I'm corresponding with everybody I think I can correspond with that I need to. My supervisor, a manager at the clinic. Eventually, at some point, I did get a call from my supervisor saying that, you know, I have been approved for my telecommute. So I said, okay, great. At some point, they said they've revoked your, they've taken it away, telecommute. You're to report at work. And at first I thought, and I think it was on a Friday, and I said, okay, all right. Okay, I guess I'll see you on Monday. That weekend, all I can do, I couldn't sleep. All I was thinking about, you know, I wasn't trying to think about it, but the reality came back to me. Hey, you can end up in a hospital. You know, you're not going to, my lungs. And I started thinking the reality is I literally could die. And the problem is going to be is that if I die, nobody's going to be able to do anything about it. If I'm struggling in a hospital, laying in a room, trying to recover, you know, in ICU, nobody's going to be there to say I'm sorry. Nobody's going to, you know, everybody's just going to kind of look at me as I'm drowning. Because that's what it feels like. It feels like you're trying to breathe and you're drowning, but nobody can do anything about it except just, you know, give you medication to ease the pain, but you're drowning. And that whole image, and I could see it, and I said, okay, I got to fight. And I started sending emails out. I started sending emails to a director. I started sending emails to the other director that's in my department, asking them why, you know, is there a reason? You know, can I get a reason as to why I'm being called back? Because there was a reason I applied for this telecommute. You know, and I wanted to know why that isn't, you know, being considered. The reason I decided to take this step, because if I ever get to that point where I'm at the hospital fighting for my life, I don't want to think to myself, but you should have said something. You should have at least stood up and said something. I want to be at least be able, you know what, I did everything I could to, you know, help and, you know, protect myself, but, you know, it's the only thing I had to do was help my family now. So, you know, so if I go in there, something happens to me, you know, I say, okay, well, I had to do it for my family. But for this time, I have to do it for me. This is the first time I'm speaking up for myself, going, hey, no, I can't do this. Yeah. I cannot put myself in a position that I might die. I mean, that's literally what's happening. Literally. Like, you're asking me to come in. And I go, no, that's a voluntary suicide to me.